So hello, everybody. I am Dr. Ted Barnett, the high-tech doctor with low-tech solutions, often known as Dr. Veggie. And I am president and founder of Rochester Lifestyle Medicine Institute. And I'm so excited to be able to welcome you all to the premiere event, broadcast of our Lifestyle as Medicine for the Planet lecture series. We've been running Lifestyle as Medicine lectures since 2016, every month, just about. And we decided to add another feature. So this year we'll be doing 4 Lifestyle as Medicine lectures for the planet. And Lifestyle as Medicine for the Planet, our LAMP series. Tonight's lecture is with Dr. Neha Pathak, and she'll be talking about lifestyle medicine for personal and planetary health. And then Dr. Susan Frieden will be joining us later to help us with the Q&A at the end. Just a little bit about our programs for patients. We run 2 programs that are certified by the American College of Lifestyle Medicine. The one that we've developed is the 15-day whole food plant-based jumpstart, which is a medically facilitated 2-week program where we teach people about medical Esselstyn-style nutrition. That's on 7 facilitated Zoom sessions over about 18 days for a total of about 11 hours. We have the Lift Project to help people lift people's moods and as a way to continue on from the jumpstart. Also certified by the American College of Lifestyle Medicine and developed by Dr. Darren Morton in Australia. And then we also have health coaching, both in groups and individual coaching, which is available to members of our audience and also as a useful tool for healthcare professionals looking for a little more help for their patients. Let me tell you about our lecturer tonight. Dr. Neha Pathak is board certified in both internal medicine and lifestyle medicine and works as WebMD's chief physician editor for health and lifestyle medicine. And she's host of the Health Discovered podcast. She reports on topics related to lifestyle, climate change, and environmental impacts on health for WebMD and Medscape, and is a regular contributor to Yale Climate Connections. Dr. Pathak is a member of the American College of Lifestyle Medicine Board of Directors and chair of the Global Sustainability Committee. She is also a lecturer at the Yale School of Public Health, where she facilitates coursework on climate change and health. She is a founding member of Georgia Clinicians for Climate Action, and Dr. Pathak has been invited to join the National Academy of Medicine's Communicating About Climate Change and Health Project expert panel. Through all of her work, she hopes to educate healthcare professionals and the public about the health impacts of climate change and environmental pollution. She lives in Atlanta with her husband and children. And once again, lifestyle medicine for personal and planetary health. Dr. Pathak, would you like to come out from behind the curtain, please?
Good evening. Thank you so much for having me.
Absolutely. It's great to have you here, and welcome aboard.
Thank you. And I'll share my screen.
Great. And I'm going to disappear, and we'll see you on the other side. Thank you very much.
So welcome, everyone. I'm so excited to spend an hour with you all today. On the screen right now, I have my objectives for our time together. I'm hoping that by the end of our time together, we understand the severity and urgency for addressing planetary health and climate crises. I hope that we can figure out ways to describe how lifestyle medicine interventions improve health, not only for individuals and communities, but also the planet. And then I want us to think about lifestyle medicine prescriptions through a climate and health lens as well by the end of our time together. I think beyond our objectives that I have listed here, I really also have hopes. So I imagine that tonight I'm speaking with a lot of like-minded individuals who are really passionate about learning more about lifestyle medicine to improve their health. And I imagine that a lot of us are also really aware about the health risks that climate change and planetary degradation pose for not only ourselves and our families, but for future generations. But my hope really is that after our time together, we think we have strategies that we co-create that might help us address misinformation and potentially bring others along on a lifestyle medicine journey, not only to protect our own health, but the health of the planet. So if there are things that really stick from this presentation today, I hope you'll share that. If there are things that don't quite land, I hope you share that as well. So let's jump right into today's topic. So climate change. And this infographic I always show when we think about climate change because this is what is traditionally shown. We see greenhouse gases at the top. We see an entire cascade of interrelated impacts from the emission of these greenhouse gases, leading all the way down at the very bottom to health impact. Now, the dots between greenhouse gas emissions and health harms are quite convoluted, interconnected, overlapping. And I think what happens when we see an image like this is what happens to us when we think about climate change in general. It's overwhelming. It is really difficult to see ourselves individually being able to have any impact on this process. And it's really hard to think about how we might bring this into the exam room to improve our health. So I will remove the image and I'll start with something, I'll bring us to something that really we know and we recognize is in the health realm. So this is a normal pattern EKG. Most of us know that an EKG is a tool that health professionals use to think about one parameter of our health, our heart health. So we recognize that in terms of a normal pattern, there is a normal cadence. There are peaks, there are valleys, there's movement. But in general, when the pattern is normal, we recognize that we are in potentially good health when it relates to our heart. But we also recognize that when there is a massive derangement, when there's a shift, when there's a change in that normal pattern, and that's combined with symptoms like chest pain, shortness of breath, diaphoresis, or sweating, that this is a medical emergency. And we recognize that with this medical emergency, there are a couple of things that we know. Number one, there is a closing window of opportunity to save this patient and stave off the worst impacts. And we also know that we have the tools, the technology to come together as a team to actually protect this patient. So I'm going to shift gears a little bit now to what I think of as our planetary EKG. So again, this is one parameter of our planet's health, and this is looking at carbon dioxide levels for hundreds of thousands of years. So if we go back using this data, we can look at this pattern over 800,000 years using ice core samples. And what you'll recognize, it's not as pristine or as beautiful as the EKG for a human heart, but I would posit that the planet is a little bit more of a complex entity than the human heart. But what we do see is we see a cadence of peaks and valleys over time. We see somewhat of a typical rhythm. And this is what we're seeing today. A massive derangement coupled with the symptoms of heat waves, flooding events, wildfire events that are happening all across the globe, different times and different places. But I would submit to you that just like in our EKG example, when we take all of this together, this is a health emergency. We have a closing window of opportunity in order to protect the health of this patient being the humans on this planet right now, the population on this planet. But just like our EKG example, I would suggest, and the science shows, the evidence shows that we have the tools, we have the technology to come together as a team and stave off the worst impacts. So I hope that that is enough to convince you that climate change and planetary health is something we should be thinking about when we're thinking about health. But if not, then I'll share with you that this is the opinion of health professionals across the world that have come together to show in various medical journals the impacts that climate change is having on our health. And this is one infographic. Again, I'm a big fan of busy infographics, I see, but I'm just going to try to walk us through it. So in the very inside circle, what we're seeing is the climate impacts of increasing greenhouse gases from rising temperatures, more extreme weather, increasing carbon dioxide levels in our atmosphere, and sea level rise. In that outer circle, what we see are environmental changes that are happening because of these climate shifts. And in the outermost layer, we see the health impacts that then extend out from all of these various changes, from longer periods of pollen season, so higher rates of asthma. When we think about the impacts on our water quality from rising sea levels and water supplies, we are concerned about malnutrition, diarrheal disease. So we can see that there is really nothing with regard to our health that climate change doesn't touch. And now I want to sort of broaden the umbrella of what we think about, because I think most of us recognize climate change as a threat to our health, and we hear a lot about climate change, but I want to ground that health, that problem within the context of a larger problem, which is the problem of planetary health. And planetary health is a relatively new concept that people are getting to know. It's a transdisciplinary field where we're really thinking about how all of the pieces of our planet interact to impact human health. You may know it as a concept of One Health. There are other sort of frameworks and paradigms that have been used in the past, but currently planetary health encompasses not just climate, but the changes and the degradation that we're seeing in our soil, in our water, because of land use, air pollution. So all of that comes together under the definition of planetary health. So just to ground us a little bit more on what we're seeing beyond climate change when it comes to planetary boundaries, I wanted to share this framework with you. So this is a framework that basically shows us a set of limits that scientists have estimated that we need to stay within to ensure that we have a safe operating space for humanity now and into the future. What you see in the green region are essentially where we're living within safe operating space, so below the boundary. In the yellowish range, what we're seeing is a zone of uncertainty, increasing risk as it relates to operating outside of what the planet can sustain. And in the red zone, we're beyond an area of uncertainty, and we're into a very high risk area as it relates to a planetary boundary. So this data is from 2009, where 7 boundaries were assessed, and at that time 3 were crossed. So the boundary of climate, by the biosphere integrity, so that would mean biodiversity, and biogeochemical flows, so global nitrogen and phosphorus cycles. This chart shows what happened, or what scientists found in 2023. So within the 14 years, human activity has essentially pushed us out of planetary boundaries for 6 out of the 9 boundaries. So more and more, we can see that beyond climate change, the way that we as humans are interacting with our planet is pushing us beyond sustainable operating range for a variety of planetary health pillars. And that leads us to an update in the 200 journals that I had mentioned earlier, where medical professionals across the globe came together to say that climate change is a major health threat. These same journals came together just a year ago, so 2 years after that original editorial, to say that we not only need to think about climate change as a threat to our health, but the crisis of nature, the crisis of planetary health as one indivisible entity. And we need to approach all of these crises together so that we can not lose the gains we've made in public health over decades. So I hope that I've convinced you that as humans and health professionals, we need to worry about climate change and planetary health as it relates to human health. I'd like to take it a step further for those of us that are really interested in and understand lifestyle medicine to be foundational to not only preventing disease, but treating and managing chronic conditions, is that climate change, planetary degradation also threaten those very basic pillars. So when it comes to food, these are all headlines that I've found over the past year or so. So what we see is because of climate impacts, we're losing access to vegetables, nuts, berries because of extreme weather. These things are costing more, these healthy foods. We're also seeing huge impacts on farming communities where climate extremes and extreme weather are leading to crop loss. And this infographic I really like because it shows the complex interaction of climate change and the various climate impacts and the impacts that it has along the entire food supply chain, from production to processing to consumption. And then one final very busy infographic is to help us understand that not only are climate and planetary threats impacting food quantity, but there is a significant amount of science that's showing that these are impacting food quality, nutrient quality in our crops as well. So I'm going to take away some of the busyness, but essentially what science is showing us at this point is that the elevated amount of carbon dioxide in our atmosphere, coupled with soil nutrient changes, are leading to significant degradation in the nutrient quality for our food. So Sam Myers is someone who from out of Harvard, and now the Planetary Health Alliance, which has moved to Johns Hopkins, has done a lot of research on food crops like wheat, corn, and rice, and showed that when these crops are exposed to carbon dioxide levels that we anticipate by 2050, these plants can lose as much as 10% of their zinc, 5% of their iron, and 8% of their protein content. And recognizing that many people, particularly populations in the global south, rely on these staple crops for their nutrition, those types of major changes can have significant impact on the health of major swaths of the population across the world. So this is just, I think, really important for us to think, understand our current state, which is that 2 billion people already are micronutrient deficient across the world. An additional 2 billion people are, though overweight and obese, are malnourished. So this is our current state, given what we've just talked about with regards to threats to food and nutrient quantity and quality. We can anticipate that the crisis to our food pillar is a major threat to lifestyle medicine. So now I'm going to shift us over to another prescription that's in our lifestyle medicine arsenal, which is a physical activity prescription. So when we think about some of the experiences and the exposures that many of us have experienced over the past year, from major flooding events to, I think probably, I'm sure in Rochester, you all may have experienced the smoke from the wildfires in Canada affecting air quality. It's very hard to suggest you go out and perform physical activity, or a health professional to prescribe physical activity in these types of conditions. And then when it comes to longer and longer hot seasons, so I am currently in Atlanta, where when it's hot, it is very, very difficult to go outside. We are already seeing weeks of hotter, longer periods of risk for heat waves. So again, degrading our ability to prescribe physical activity to our patients. Threats to the sleep pillar. So I don't know about you, but this is one of my favorite pillars. And what we're seeing, just as we're learning and recognizing the importance of sleep to prevent and manage chronic conditions, we're seeing that amongst a variety of threats to sleep in a world of climate chaos, there's growing evidence about how rising temperatures, particularly rising temperatures that don't diminish overnight, creating havoc on our sleep prescriptions. And this is particularly an issue for people living in cities where the urban heat island effect actually increases the heat people experience at night because concrete and those other structures are radiating heat out at nighttime. So moving on to our stress management prescription. Again, so many climate threats to stress management, but we have a robust evidence base now showing how heat has significant impact on mental health. And we are seeing, as I mentioned, longer and longer periods of high intense heat waves, more frequent heat waves as climate chaos worsens. And then the risky substance pillar. So again, through a variety of pathways, more and more we're seeing emerging evidence of climate change being a threat multiplier in many ways. And one of those ways is also increasing drug and alcohol use disorder. So this is just pointing to one particular study that found increasing drug-related hospital visits during periods of high temperature, and the potential anticipation of this type of exposure getting worse. And then finally, I want to talk about our social connection pillar. So I am not sure if any of you have experienced any of the climate chaos to the level where it has completely destroyed neighborhoods or communities in your region, but just last week, new data from the Census Bureau estimated that about 2.5 million people were forced from their homes in the US just last year because of severe weather-related disasters. By 2050, it's anticipated that there will be over 200 million climate refugees that may have had to flee their homes. This is globally. So not only do you lose your place and your space in this world, that also leads to significant loss of social connection in a climate chaotic world. So at this point, I hope that I've convinced you that we need to care about this from a health standpoint. We need to care about this from a lifestyle medicine and health standpoint. And then I just want to ensure that we really think about this from the standpoint of health equity. So I find that this is a little bit of an older image, but it makes the point really, really nicely, I think. It shows historic carbon emissions. So what we see here is that in this map, what you see on the very top part of the map is a very bloated North America, bloated parts of Europe, and very shriveled up a global South. And what you see in those bloated areas are really where you have total carbon dioxide emissions from 1950 to around 2000. So historic carbon emissions from fossil fuel burning, cement production, gas firing. So all of that is where the majority of carbon emissions came from. And in the map down below, you see a very bloated global South, particularly regions in South Asia and Africa. And that's where you're seeing where the majority of mortality and health impacts are anticipated just from 4 climate sensitive conditions. Now, I do want to update this a little bit in terms of where carbon emissions are coming from now. So this is from the Global Carbon Project showing where total CO2 emissions are coming from in 2020. And you see that regions in Asia have caught up, and you have many more carbon emissions coming from China, India. But when you think about it per capita, we still, in the US, play an outsized role. In Australia and other parts of North America, unfortunately, our per capita emissions are still quite large. And that health equity dimension replays itself not only on the global stage, but also on the local stage. So this particular map is showing the urban heat island in Washington, D.C., but quite honestly, this map replicates itself city after city across the country. And what you see in blue are the regions that are higher socioeconomic status, so more tree canopy, lower temperatures, more access to healthful foods, more access to safe spaces to recreate outdoors. As I mentioned, more green canopy, less pollution. And the inverse is true in those red areas. So lower socioeconomic status, populations that are predominantly Black, brown, and this also replicates itself in indigenous spaces. But what you see, the inverse being true is less tree canopy, more exposure to high heat, more exposure to climate and environmental injustice, and lower exposures to all of those health promoting lifestyle interventions that we have been talking about. So I want to now make a transition to the good news. And I promise that there is good news. So I think we all recognize, and what we hear about a lot is that we've got to address global climate change, planetary health, and one of the major ways of doing that is to rapidly reduce global greenhouse gas emissions. And where we normally hear media and where we normally think about action is in the energy sector. And that's great, that is important. Energy is about 2/3 to 3/4 of global greenhouse gas emissions. So getting off of fossil fuels is absolutely a top priority. So this does appear to be sort of a very beautiful image and a beautiful world, solar panels and wind power and changing our lights and recycling. But again, really hard for us to recognize how, as health professionals, we might consider advocating for these things in an already busy clinical practice. So I'd like to shift us to strategies that a variety of organizations have suggested or have shown evidence for that would not only shift us towards lowering greenhouse gases, but also allow us to build thriving, healthy, equitable, climate resilient communities. And whether we're thinking about or looking at research from the Lancet, from the World Health Organization, from the National Academy of Medicine, from the Intergovernmental Panel on Climate Change and Health, various organizations globally, an interesting pattern starts to emerge. And that's that when it comes to some of the prescriptions for shifting us to these healthy, equitable, climate resilient communities, they all start to repeat themselves and sound very familiar to a lifestyle medicine audience. And essentially, these are things that we are already recognizing as critical to human health. So I'm going to lead us through a whirlwind tour of how our lifestyle medicine prescriptions have massive, robust ability to shift the climate and planetary health conversation. So number one, our nutrition pillar. So this is Project Drawdown. Project Drawdown is essentially a group that came together to elevate the 100 most robust climate solutions that not only will sort of plateau the CO2 curve, but actually start to draw that CO2 curve down. And when we think about the 100 most robust interventions, we see that number 4 on this list is a shift to plant-rich diets. And this is, I think, really critical. This shifting to a plant-rich diet and really thinking about the lifestyle medicine nutrition pillar is not a solution on the periphery. It is a central, robust solution for climate and human health, as we know. And I think it's critical that we recognize that even if we reduce all of the non-food emissions that I discussed earlier, emissions from food production alone could shift us past climate targets. So I think it's really critical that we think about how we're going to shift the conversation, not from fossil fuels, but to add plant-rich diets as an equally important solution. So now I wanted to just take some time to dig into why it is that the food system plays such a huge and outsized role in climate change and planetary health. So let's arm ourselves with some of this information. So about 1/4 to 1/3 of global greenhouse gas emissions come from our food system and from a variety of sources, from deforestation, land use changes, emissions from fertilizers and manure, and methane from cattle. But if you look at where I've sort of highlighted 3 areas, over 50% of our emissions are related from the food sector are related to animal agriculture. And I like to look at that data in a little bit of a different way. So what we think about, and I find this graph to just be really, really important in our understanding as we think about the various greenhouse gas emissions across the supply chain for a variety of foods. What we see are the foods that we recognize as the most healthful as part of a plant-rich diet are those foods that have the lowest greenhouse gas emissions. The foods that we know that the science shows are lead to poorer health actually are also responsible for the largest share of greenhouse gas emissions. And I think another very important point to point out from this graph is that often we're told, well, eat local, and transport and packaging play a major role in greenhouse gas emissions. And this chart really helps us to understand that it's really more about what you're eating than where it's from. I'm not suggesting that you don't think about it, but to recognize that making a shift in terms of what you're eating and shifting more towards a plant-rich diet has much more of a greenhouse gas impact than thinking about transportation and packaging. This slide I like to share with folks because a lot of people are very concerned about how are they going to get protein in their diets, and then what about protein? And just as we saw on the other graph, this replicates itself when we think about protein sources. So tofu, grains, certain types of farmed fish, much lower greenhouse gas emissions relative to ruminant livestock. And I do want to take a little bit of an aside and talk about cow burps. So this is often a punchline, and it's often something that people use to dismiss the outsized impact of livestock on climate change and greenhouse gas emissions. But it's not really a laughing matter. It's really all about the methane. So I wanted to arm you with some information from the National Climate Assessment when it comes to understanding cow burps and why they play such a major role. So first, it's important for us to recognize the global warming potential of a particular greenhouse gas. So the Intergovernmental Panel on Climate Change uses a metric called GWP, so Greenhouse Warming Potential 100. And what that does is helps you understand relatively how strong is a greenhouse gas over 100 years with regard to climate impact. And the value for methane is 28 times that for carbon dioxide. So what that means is that it's a shorter lived greenhouse gas in our atmosphere, but it has much stronger global warming potential. And what we see here is that about 1/4 of the methane that comes from the US actually comes from the belching of cows, because cows and other sort of ruminant livestock, they acquire their nutrients from fermenting plant-based food, essentially through a special anaerobic process. And in that process, a lot of methane is released. So what we see is major source, fortunately, of the US of methane comes from livestock and their manure and its manure. So again, this becomes a major problem when we think about proportionality. When we think about what livestock do with regards to methane production, and then we recognize that what we as humans have done to the weight as mammals on the planet, 60% of mammals on the planet are livestock. So cow burps and cow belching, unfortunately, poses a significant impact when it relates to greenhouse gas emissions and climate change. And now I want to ground us a little bit more beyond sort of the role of food in just climate change. Food has significant and major environmental impacts as well. So we talked about the greenhouse gas emissions, but 50% of the world's habitable land is taken up by agriculture. 70% fresh water is used for agriculture. About 80% of global oceans and freshwater are polluted because of agriculture and our current food supply system. We've already talked about biodiversity loss because of the pressures from our agricultural system. I'm not going to spend a lot of time on this, but I do think it's important for us to recognize that food waste is also a very important part in the greenhouse gas story as it relates to the role of food. So if food waste was a country, it'd be the third largest emitting country in the world. So not necessarily something that I would bring up in the context of a clinical visit. But if you have time to bring this up in your clinical encounters or in your home, if you have time and the ability to think about it, it is a critical step in lowering the greenhouse gas emissions from food. And then I wanted to just shift us one last time to thinking about, well, what would happen if as we start thinking globally about large shifts towards a plant-based diet? And what you see, just as it relates to land use, is that if we shift the current global diet to a diet that removes beef and mutton, so we're still talking dairy is still being incorporated into our diets at the same level as currently, we're having the cropland being used to house our current agricultural system. When you eliminate beef, mutton, and dairy, we are now 75% less land use for agriculture. And it's even better if you are able to sort of shift towards a vegan diet. But significant improvement in our land use from shifting globally towards not even a vegan or optimal diet. And I finally sort of like us to end our sort of discussion about the food pillar, really leaning on the Eat Lancet Commission's Planetary Health Diet. So if this is not something you're familiar with, I would definitely encourage you to look at their website. It is a phenomenal resource, and it is a global resource to show how shifting our diets based on different regions allows us to optimize human health, but also allows us to live within the planetary boundaries that we've discussed earlier. And this shifting to a diet like this, which is not a vegan diet, would prevent about 11 million deaths every year. And in lower to middle income countries, there may still be, it still allows for a potential increase in animal source foods to meet nutrition requirements. But in high income countries, it calls for significant reduction in red meat and dairy foods. So when we're thinking about that climate, lifestyle, medicine, planetary prescription, shifting towards a diet that looks something like this is a great step forward. And if you look at this plate, it's very similar to what most lifestyle medicine practitioners are already prescribing for their patients. A half plate filled with fruits and vegetables, decreasing our consumption of processed food and meat, particularly red meat. And it helps sort of allow us to think about shifting those who are currently eating a very red meat heavy diet to incrementally switching to less greenhouse gas intensive um, animal sources such as poultry or fish, as we try to optimize ourselves toward a more and more fully plant-rich, plant-based diet. And if you are looking at this and thinking this looks pretty similar and pretty close to a modified Mediterranean diet, that is a great way of thinking about it in a frame that already connects with a lot of people. But crucial if you're thinking about this or counseling patients towards this type of diet, to really think about flexibility, culinary traditions, and food preferences to help people make the shift towards this sort of eating pattern. And as we've talked about, for folks that already have a very meat-rich diet but are endorsing this, they do want to shift towards a reducitarian, climatarian diet, then they have allowable limits in the Eat Lancet diet for certain types of animal-based foods. So 1 serving of dairy a day, and then 1 serving of one of these types of meat, with red meat being something you should only have 1 serving per week. So I want to shift us now towards our other pillars, because we have 5 more pillars of lifestyle medicine to talk about. So very briefly, thinking about active transport, physical activity, not just for our health, but also for our environment. We know that in US cities that have the highest rates of walking and cycling to work, there are 20% lower rates for diabetes and obesity when you're comparing them with the cities that have the lowest rates for walking and cycling. So one potential tweak, if you are climate and lifestyle medicine minded, is to think about walking or biking instead of driving, especially distances that are less than 2 miles. And according to the Department of Transportation, around 40% of all car trips are actually less than 2 miles. In one study in the Midwest, where they modeled out what this would mean if people did this just a few months out of the year for car trips that were less than 2 miles, clearly you'd have lower greenhouse gas emissions, but they found that 1,300 lives would be saved every year, and 8 billion in healthcare savings would be achieved just from the benefits of better air quality and less sedentary lifestyles. And now I want to bring us to our prescription for avoiding risky substances. As we talked about in the beginning of our time together, climate change, climate risk, climate chaos has the potential to increase the use of risky substances, alcohol use, other types of substances. And so number 3, we still see that when we think about global burden of disease risk factors, tobacco is number 3, alcohol use is number 9. But what I'd like to bring your attention to is air pollution, which is the 4th leading risk factor for death globally, which I think is quite staggering, and which is why a lot of lifestyle health professionals, myself included, are starting to think about adding air pollution as a risky substance, or at least expanding our understanding of what a risky substance is to incorporate toxic exposures. So when we think about why, I'd like to point your attention to the black boxes at the bottom. These are the sources not only of greenhouse gas emissions, but also of toxic pollutants in our air. And in the light blue boxes, you see a lot of health outcomes that we as lifestyle medicine professionals are trying desperately to lower. So heart disease, type 2 diabetes, cognitive decline. And what we see is that air pollution is a major risk factor for developing the very chronic conditions that I'm trying to lower, and exacerbating the chronic conditions that I'm trying to lower with my lifestyle medicine prescriptions. So if you're thinking about this also from this pillar from a climate, planetary health, lifestyle medicine lens, my suggestion is to also think about how we might advise our patients, our families, to monitor the air quality index, for example, avoid outdoor activity when the AQI is at dangerous levels. Briefer prescription than it is sometimes counseling against other risky substances. And I would suggest no one is addicted to air pollution. So makes that conversation a little bit easier to have as well. So just from 3 prescriptions, we see massive potential to lower the 11 million premature deaths from poor diets, close to 4 million premature deaths from inactivity, and close to 9 million deaths from emissions of PM 2.5, one of the most dangerous forms of air pollution. And in a really interesting modeling study, just looking at 9 countries, the researchers found that if we were to make some of these lifestyle shifts according to a sustainable pathway scenario, so really putting these lifestyle changes, these health impacts at the center of climate change and health, you'd see just in 9 countries by 2040, millions of deaths avoided from plant-rich diets, increases in physical activity, and avoidance of air pollution. Again, now we have 3 prescriptions remaining. So I would suggest for our prescription for social connection, for our prescription for sleep, for our prescription for stress management, considering nature prescribing, and whether that is nature in its wildest forms or urban tree canopies, we recognize that there are health benefits to interacting with nature in any of its forms. I'd also suggest for the spiritual health of many people. So for many of us, culturally, traditionally, spiritually, we see these spaces as sacred. So protecting and preserving these spaces, ensuring that we have access to spaces is not only important for our physical health, our mental health, but also our spiritual health. And this graph just shows in Atlanta alone, which is known as Tree City, the health benefits from a planetary and climate standpoint. And then I want to take an extra minute to really highlight the social connection pillar. It is probably one of the most important pillars to protect health and prevent death in the setting of a more and more increasingly climate chaotic world. We're now seeing increasing evidence that lives are saved during climate emergencies when people have known social connections. So critical for us to be thinking about the people in our communities, to be thinking about prescribing social connection, not just for health, but also as an adaptation strategy as we face more and more climate chaos. And then I want to bring us to a final piece, which is thinking about the healthcare sector in general. So the healthcare sector itself is responsible for about 8.5% of greenhouse gas emissions in the US. And there's a variety of areas where the healthcare sector is responsible for that. But I want us to hone in on that red and orange area, which is the greenhouse gas emissions from the healthcare sector because of food and because of pharmaceutical use. So just sort of zoning in on the pharmaceutical piece, we now have emerging body of evidence that deprescribing is very possible with lifestyle medicine in interventions. And that is key for us to think about where there is a large segment of greenhouse gas emissions coming from our use, potential overuse of pharmaceuticals. So this more research is needed in this area, but I submit to you that as we think more and more about lifestyle medicine interventions to protect human health, we're also potentially having an impact on greenhouse gas emissions from the healthcare sector. And then finally, I did want to do just an additional call out to health equity. So we know that the US in the developed world is one of the largest regions of the world with massive health disparities. And the same population that has less access to lifestyle medicine pillars is the same population often that is suffering the most from environmental and climate injustice. So when we think about these prescriptions, we should also not only think about them as health prescriptions, as climate prescriptions, as planetary health prescriptions, but also as health equity prescriptions. And I hope is that we think about not only how can we increase our access to plant-rich diets, green space, safe places outdoors for active transport, safe places to gather for ourselves as individuals, but as communities, and particularly for communities that are already suffering the ravages of health inequities. So I will stop there. Whew, our whirlwind tour. I will open it up to you all then.
Fantastic. Thank you so much, Dr. Pathak. That was wonderful. Dr. Friedman, what question would you like to see Dr. Pathak address first?
Well, first of all, I just want to say thank you for that really amazing, comprehensive discussion. Really incredible information, and so wonderful to think that certainly as lifestyle medicine practitioners that we can both help our patients and the planet at the same time. I have to say, I was really struck by that map that you showed of Washington, D.C., and just the temperature changes, or the temperature diversity within really a small geographic space. And it seems like it's an opportunity for collaboration between medical people, city planners. What do you see sort of on the national level in terms of people working on those kind of things? Because it seems like that could make a significant impact.
Yeah, I think it is a really important. I think when that study came out, there was this study that looked at hundreds of cities across the country and looked at the urban heat island effect. So not when we think about what the weather forecaster is telling us that is going to be the temperature for the day, you're actually seeing 15 degrees higher temperature in regions where people of lower socioeconomic status live. And a lot of that is because of redlining. So not accidental, but intentional sort of de-treeing, de-greenifying, removing tree canopy, creating spaces that are essentially concrete jungles. And so that is, I think, was really important historical context. Number one, I think it was really important to show that in real time, what is the impact as it relates to heat, which we know is going to become more and more of a problem as time goes on. But it also offered up an amazing solution, which is planting trees, tree canopy. So we do see, with regard to urban planning in major cities, people recognizing the importance of tree planting as a prescription to lower temperatures and not use more carbon intensive technology. So for example, more air conditioning. So really thinking about tree canopy and certain investments from the Inflation Reduction Act, which are looking to be used by cities and city planners for the health benefits, but also sort of the climate benefits. So I hope that's answering your question. The other piece of it, though, is that not all trees are created equal. So it's really an important debate within urban planning. Certain trees, like I mentioned, climate change lengthens pollen seasons. So urban planners have to be really thoughtful about the trees that are being planted so that you're not exacerbating pollen allergies.
Yeah. So
interesting.
what are the top tree, if one were to plant a tree, what would you say are the top trees to plant?
So it's very region specific. This much
Oh,
I've
okay.
learned. So it's very different for Phoenix than it would be for Atlanta. It also has to do with the gender of the tree. So a very important sort of discussion that urban planners have, and that's why you see tree ordinances that seem so specific. And from a climate standpoint and health standpoint, you're like, why are you making it so hard to plant a tree? But this is why, because they really need to think about runoff, what's native to that region, and what is the gender of the tree.
Very interesting.
Yeah. Well, thank you for that. I'm actually going to help Dr. Friedman here a little bit because she's looking over the questions herself. But this is, in a lot of ways, we already know the answers, right? And so much about, and this is really about human behavior, which is what lifestyle medicine is all about, right? It's human behavior. But we're talking about human behavior in large numbers, which as soon as we get to that, then we're talking about politics. So I'm going to actually, before I ask you to even respond to that, I'm just going to sort of segue to a question that somebody put in here, which is kind of like that, which is, this is a question from the Q&A. I suspect most people who watch or read this info are already aware to some extent and accept what needs to happen. How do you reach out to those who have been conditioned to turn their backs, but who we need on board to be successful?
Yeah, I'm going to put on my sort of medical journalist hat for that question, which is when we write stories for certain outlets, we won't write the word climate change in the headline because we recognize that that word turns off a lot of people. We'll put things like environmental degradation, or we'll put the downstream effects. So more ticks in your region, more mosquitoes in your region because of climate change. So I think number one, if we're thinking about the education piece of what are some of the health risks that you need to protect yourself from, that's how we get that information out there. So really kind of recognizing your audience. I think lifestyle medicine is really important. And so that's why I feel like if we can just get a wave of lifestyle medicine providers on board, whether it's because they're interested in the health impact or whether it's because they're interested in the climate impact, we recognize as health professionals that care about both things, that this tool works for both. We don't necessarily need to use that language in an exam room or in an encounter with someone who doesn't agree with you politically. We can use the health message for that person. We can use the environmental message for someone who cares more about the environmental pollution. And more we're seeing about 56% of youth that were surveyed recently in a Lancet journal that said thoughts about climate change and fears about climate change impact their daily life. Every day they think about it. So there is a whole generational group of people where this might be, it might not be an in to talk about lifestyle medicine because of their personal health, but climate becomes an in to talk to them about lifestyle changes. So I think it's just sort of recognizing your audience and recognizing how robust a tool lifestyle medicine is, and using the right message at the right time with the right person.
That's great advice. I'm going to turn over to Dr. Friedman in just a second, but it is 9 o'clock and we're going to officially end, but we are going to move into the lobby. If Dr. Pathak is willing to stick around for a few more minutes, great. And I'm just going to share my screen. I just found the right slide here. And just to let people know that we do have these 3 programs are available for your patients or if or your friends and relatives. The 15-day Whole Food Plant-Based Jumpstart, which teaches plant-based nutrition, the LIFT project, and we also do have health coaching. And if you enjoyed tonight's program and you'd like to keep us in business, we'd love it if you could support us. Aim your phone at that QR code. That'll take you to a donation page. We are a nonprofit organization. Most of our support does come from donors, and you could be one of those donors. My wife and I are full-time volunteers, but we have a staff of about 7 full-time employees and about 5 or 6 part-time employees. And if somebody could put the link into the chat as well, that would be great. And I'm going to stop sharing and turn it back over to Dr. Friedman. Thank you.
Okay. An interesting question about thoughts about how we will address, you had mentioned about the decrease of nutrients in plants and in the soil. And as we try to move people towards eating more plants, how do we sort of square that with the decreasing nutrient content?
So there are strategies being looked at right now to bioengineer our food. This is not new, but this is sort of one strategy to ensure that the genetic makeup of foods and crops that are essential are climate resistant, so drought resistant, potentially requiring less water, but also genetically modified in some ways to maintain their nutrient content. So this is something that is being studied and implemented in it's not science fiction like it used to be.
Yeah, a question about how do we, you had made the point that food is really, such a significant, we can make a big impact through the food that we eat. And how do we turn the topic of environment from cars and pollution like that to the food that we eat?
I think I would love that conversation to be maintain the conversation around cars and fossil fuels and add food as as another lever. But I think food in some ways, depending on how you frame it, is an easier dot to connect to health. I think that most people have heard at this point about the Mediterranean diet and its benefits for health. I think the amazing thing about the planetary diet is really very similar to a modified Mediterranean diet. So if someone recognizes that piece, it's actually easier to have that conversation and connect it to one's health than it is to say, switch to an EV or do something that's sort of a higher capital purchase. This is a change you could make tomorrow. If you have a meat heavy diet, you could make a significant impact just by changing one meal a day. If you're a health professional, you have 1,000 patients on your panel and 10% of those patients take up this change, you've made a significant impact.
Very good.
Yeah.
Yeah.
Well, that's what we always tell people is that you can change your diet tomorrow. You don't have to buy a new car. You don't have to change your light bulbs, but you can change your diet your next trip to the supermarket. And
yeah. I'm really looking forward to your to plug your work some more as well, is the talk with Dr. Shailesh Rao. I think in terms of like transformational change and what does that look like from a systems level, I think that is critical. Clearly, it's not just an individual action versus collective action, it's both. But I think that's where we play such an important role as trusted messengers. So as health professionals, it's clear we play an outsized role as trusted messengers when it comes to climate and its impact on health. So we can make that help with potentially that individual change, but I'm really interested in what he has to say about making change on that systems level.
Yeah, thanks for that. Actually, if one of our staff could put the link to that event into the chat, people could click on it and sign up now. Yeah, Dr. Shailesh Rao will be our next Lifestyle as Medicine for the Planet lecture, and I believe it's in April. So great. Okay, I think we have time for one more question, Dr. Friedman.
There's a question about all the plastic that we have in the supermarkets. A lot of waste and how to move the needle on that.
So I think it's horrible, all the plastic and the packaging. And in fact, there's the petrochemical industry as it shifts from fossil fuels is shifting towards, plastic production. So it's not good. I think it's just important for us to recognize that when it comes to the biggest bang for our buck, it's what we eat. So we really want to shift towards that plant-based diet. But then as consumers, we also can make a choice to shift toward potentially, and this again sort of depends on your capacity as a consumer to make these changes, but to buy from places, excuse me, where they're not using as much plastic, where you bring your own bag. I mean, I think that it's really interesting social norming. So when you come with your bag and you talk about the fact that you brought your not even your reusable plastic bag, but your reusable cloth bag, that changes behavior for others around you.
Yeah, that's right.
So
Dr. Pathak, I'm just curious, but I know you have kids. How do you talk to your kids about this, and how do they relate to their friends, and how does that all fit together?
My children are young, so they talk about it much more than I would. I think that my frame was to try to protect them from it as a parent and not necessarily talk about it, but it is part of their lives. It's part of their conversation. And I think it's interesting because it's really they who are bringing it to me. They'll say, hey, there's a sign-on letter we need to send so that they don't drill here, or there is, social media does very interesting things. My children are not on social media. I still think that they're way too young, but it allows our youth to see global problems much more locally than we were able to do, I think. So their empathy levels are just so much higher because they're seeing really so many people that look like them, that are their age, suffering around the world. So I think it's sort of the opposite of what we as health professionals, the see one, do one, teach one, we're usually top down with that. This is really a bottom up movement. When they're seeing it first, they're telling us, and then we have to, help push this movement forward for them.
How old are your children? You said they're very young. How old are they?
12,
Oh, okay.
10, and 3. So the 3-year-old has not brought it to my attention yet, but
But the 10 and 12-year-olds are obviously very aware. So fascinating. Dr. Pathak, do you have any final words for our audience tonight?
I just want to say that I think that what we're doing is already having an impact. So if you're already making these shifts, you're already having an impact, and it's really important to talk about it, to share that you're doing it, because it's the social norming that changes behavior. We've got to make it fun, we've got to make it easy, and we have to make it social. Talking about it is one fun and easy way of doing that.
All right, everybody, let's go out there and do some social norming. I love it. Thank you so much, Dr. Pathak. You were wonderful. Dr. Friedman, thank you for your help. Bob Frankie in the background, great engineering tonight. And good night, everybody. We'll see you next time.
Thank you so much.
Bye-bye.